Well, there's a grim new milestone to report tonight. According to data from Johns Hopkins University, more than 800,000 people in the United States have died of COVID since the start of the pandemic. Also tonight, new CDC data shows the Omicron variant is more transmissible than the Delta variant and is being detected at a rate of about 3% around the country right now. Here in New York, Cornell University has shut down its campus after more than 900 COVID cases among students this week. According to university officials, a, quote, very high percentage of those cases are Omicron variant cases in fully vaccinated individuals. There is good news about Pfizer's antiviral COVID-19 pill. According to the company's final analysis, they say it is nearly 90% effective in preventing hospitalizations and deaths in high-risk patients. Joining us now to talk about it all, Michael Osterholm, the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, and a former member of the Biden transition team COVID advisory board. Professor Osterholm, I appreciate you being with us. So this outbreak at Cornell, what does that tell you? I mean, 900 new infections, university shut down, I mean, more if not all fully vaccinated individuals. What does that say?
Well, frankly, it's a harbinger of things to come. This is a highly infectious virus. As we see it move around the world and become established even at a few percent, we're starting to see in more and more really large outbreaks developing. And so I think that we are watching a war right now between the Delta variant and the Omicron variant as to who's going to become the king of the viral hill. And I think right now, Omicron's transmission potential means that it probably will win.
So, you know, professional sports leagues are highly vaccinated, highly tested. The NFL, the NHL are seeing rise in infections. A league source telling CNN that 28 players tested positive today after 37 did yesterday. I mean, what does a rise in cases among pro athletes tell you about what might be going on in the general population and people who aren't regularly being tested?
Well, you have to realize, again, we have different categories of people who are vaccinated. Those unvaccinated, of course, which we realize will continue to drive a large part of the serious illness with the Delta situation. But we're also beginning to see more and more people who have not been boosted, meaning that they're 6 or more months out from their original first 2 doses of the mRNA vaccines. Right now, only about 30% of the country has actually been boosted of those that could be. Many of the athletes we're seeing right now are actually in that category, and that's why, as you heard yesterday, the NFL, in fact, put in place mandatory vaccination for teams, not the players, but everyone else on the teams, because of that very issue. So this is why we've talked over and over again about why boosters are so important. That's what's going to continue to drive this situation.
So what do you expect this winter to be like in the U.S.?
You know, Anderson, every morning when I get up, I try to scrape the 5 inches of mud off my crystal ball and be able to predict that. And, you know, so far we've done a pretty good job of predicting where this would be. I think the battle between Omicron and Delta is going to be a key one. If, in fact, Omicron is not as severe, and I know many people don't want to hear that because they're afraid that that'll give people complacency, but I think the data so far shows that it's not as severe. But if you have it offset by many, many more people getting infected than we even would with Delta, then you might still have the same impact on the healthcare system. And right now, we're watching Delta explode in this country, particularly in the east and the southern states right now are starting to see some increase. And so I think that if Delta wins out, then in fact, we're going to see a major increase in severe illness. If Omicron wins out, we may see an increase in severe illness, and we just don't know yet.
You know, obviously, look, a lot of people listening right now at home are probably just kind of despairing because it just seems like we're going backwards. There's one step forward and then we go backwards. Does this just go on and on like this for years? I mean, you know, some people had suggested, well, ultimately the virus will kind of weaken and its ability to spread will weaken, and that's when, you know, and more people will be vaccinated, and that's when we sort of emerge into a new normal.
Well, one of the challenges we have right now is we don't really understand what it takes to be immune as a human. We know that the vaccines we have are remarkable tools, but we're also realizing they may only provide limited long-term protection. And so until we can get potentially a better understanding of that, the question will come up, well, we need new boosters in 6 months from now. We don't know. And we just have to be honest with the public and say that. This is a time where science is learning by the day and then trying to translate by the night to the public. And so it's very clear we are in a confusing situation. I don't think it goes on like this forever, but for this immediate period, It's not clear what's going to happen over the next few months. We can say no matter what happens, though, you're going to be better off if you're fully vaccinated first times and to get your booster dose. You'll be better off.
And what do you make of Pfizer's new pill to treat COVID?
I think it could be a real game changer. I think it's a very important development. My concern is exactly what I've said for the last year on vaccines. You know, I've been saying there's the last mile and the last inch. The last mile is getting the vaccines to the people. The last inch is getting the needle in the arm. We've seen that 40% of the U.S. population won't take that needle. We're already hearing feedback from the street that some people are saying, well, that new drug is just part of the Biden administration, a Biden poison pill. We're going to stick with our ivermectin and not get the drug. These will be the same people that have not yet been vaccinated. If that happens, we will waste an incredibly important tool in reducing severe illness. And so time will have to tell on that.